Hi, my name is Matt Plitt, and today I'm going to talk to you about herpes simplex type 2, genital herpes, or also known as HSV2. Causes of HSV2. To be infected by HSV2, it has to get into the body through cut skin or a mucous membrane, such as inside the genital area. Each virus can be passed in bodily fluids like saliva, semen, and fluid in the female genital tract. Another way HSV2 can be passed is from a mother during vaginal birth to her baby, especially if there are active blisters around the vagina at the time of delivery. Transmission of HSV2. Herpes simplex virus 2 is a sexually transmitted disease and is usually related to genital ulcers or sores. HSV2 is spread through sexual contact. All sexually active people are at risk for genital herpes. Having multiple sexual partners puts you at even greater risk. Women have a greater risk of being infected after sex with an unprotected partner than men do. About 1 in 4 women have HSV2 compared to 1 in 8 men. Some symptoms of HSV2. Symptoms include tingling sensation in the genitalia, buttocks, and thighs. Small red blisters are open sores on genitals or inner thighs. In women, it often occurs inside the vagina. These sores or red blisters may be painful or not. Women may also experience vaginal discharge. Other symptoms include fever, muscle aches, headache, painful urination, and swollen lymph glands in the groin. Out of all these symptoms, the most predominant symptom of herpes is the outbreak of painful itching blisters filled with fluid on and around the external sexual organs. How to prevent HSV2. In terms of genital herpes, education regarding the use of condoms is a good way to prevent HSV2. Avoid having sex if you or your partner has an outbreak or active infection of herpes. Herpes outbreaks are not always obvious, and your partner may be contagious without you even knowing it. Anyone involved in an ongoing sexual relationship with a partner infected with HSV2 should get counseling from a healthcare practitioner on how to stay safe. Other ways that you can prevent HSV2. Avoid touching the sores. Use or have your partner use a latex condom even when the sores are not visible. Limit the number of sex partners. Or use a water-based lubricant to prevent friction during sex, which can irritate the skin and increase the risk of outbreak. Also, even though you use a condom during sexual intercourse, it does not mean that you will not spread the HSV2 virus, just because the condom cannot cover the whole entire area. How to treat HSV2. Antiviral medications for genital herpes can reduce outbreaks and help speed recovery when an outbreak does happen. They can also reduce the chances of spreading the virus. Coping with the emotional and social aspects of having genital herpes is a part of the treatment as well. Relaxation techniques and support groups can help. There are 3 drugs proven to treat genital herpes symptoms, which can be taken in pill form. These are known as Zofrax, Famvir, and Valtrex. Formulas, such as like a lotion, can be applied to the surface of the skin but these provide little benefit and they are not recommended to use. Although there are pills and lotions that are supposed to help aid the HSV2 virus, there is no cure for herpes, so the goal of the treatment is to reduce the number of outbreaks and to lessen symptoms when you do have an outbreak. Some stats of HSV2. The highest incidence of HSV2 is in young adults between the age of 18 and 25 years. HSV2 antibodies are present in approximately 20% of Caucasians and about 65% of African American adults. The estimated total number of people aged 15 through 49 years who were living with the HSV2 worldwide in 2003 was 536 million. Also, doing research, I could not find any information here in the state of Louisiana or in the city of Lafayette on any stats according to HSV2 virus. Some other facts about HSV2. Male to female transmission is more efficient than female to male transmission. Since the late 1970s, the number of Americans with genital herpes infection has increased by 30%. In the United States, genital herpes increases the risk of heterosexual spread of HIV. Herpes can make people more prone to the HIV infection, and it can also make HIV-infected individuals more infectious. People with suppressed immune systems, like those affected by HIV or AIDS, are affected more easily and intensely by genital herpes than other groups or people. And that concludes my presentation on the HSV2 virus.